Ever heard of hallucinations that only affect your vision? These are not the typical hallucinations you might think of, often associated with mental health conditions. Instead, they are purely visual and can be quite perplexing. What if I told you these aren't linked to mental health issues? Yes, you heard that right. These visual hallucinations are not a sign of mental illness or cognitive decline. Imagine seeing things that aren't there and knowing they aren't real. It can be a surreal experience, almost like your mind is playing tricks on you, but you are fully aware that these visions are not part of reality. Intrigued? Let's dive into this fascinating condition called Bonnet Syndrome. This condition opens a window into the complex ways our brain processes visual information. So what exactly is Bonnet Syndrome? Named after the Swiss philosopher Charles Bonnet, who first described it in the 18th century, this syndrome is a unique phenomenon. It's a condition where people with significant vision loss start seeing things, visual hallucinations to be exact. These hallucinations can range from simple patterns to complex scenes. But don't worry, this isn't a mental health issue or a form of dementia. It's purely a visual phenomenon, and those experiencing it are usually aware that what they are seeing isn't real. Simply put, your brain is trying to compensate for the lack of visual input. When your eyes can't provide enough information, your brain fills in the gaps, creating these vivid images. Now, how do you know if you have it? Recognizing the symptoms is the first step. If you experience sudden visual hallucinations after losing vision, it could be a sign. Diagnosis typically involves consulting a healthcare professional to rule out other causes. A thorough examination can help determine if Bonnet syndrome is the culprit. If you or someone you know has sudden visual hallucinations after losing vision, it's time to see a doctor. Early diagnosis can provide peace of mind and help manage the condition effectively. What kind of hallucinations are we talking about? These can be quite varied and often very detailed. These are purely visual, no sounds, smells, or touches involved. You might see colorful patterns, people, animals, or even entire scenes. The brain's creativity in these situations is truly remarkable. You might see colorful patterns, people, animals, or even entire scenes. These images can be static or dynamic, appearing and disappearing without warning. The important thing is most people with this syndrome know their hallucinations aren't real. This awareness helps differentiate Bonnet syndrome from other conditions that involve hallucinations. You might be wondering, how common is this? It's more prevalent than you might think, especially among those with severe vision loss. Bonnet syndrome is most often linked to eye conditions like macular degeneration and cataracts. These conditions reduce the amount of visual information reaching the brain, triggering the hallucinations. While not everyone with vision loss will experience it, a considerable number do. It's estimated that up to 60% of people with significant vision loss may experience these hallucinations at some point. Is there a gender difference? Interestingly, this condition affects both genders equally. Actually, Bonnet syndrome doesn't discriminate. Both men and women can experience it equally. Age and the extent of vision loss are more significant factors. So, what can you do if you experience these hallucinations? While there isn't a cure, there are several strategies to manage the symptoms. There isn't a cure, but there are ways to manage it. Adjusting your lighting, ensuring your environment is well lit can sometimes reduce the frequency of hallucinations. Engaging in other sensory activities, such as listening to music, touching different textures, or even smelling flowers, can help distract your brain from creating these visual images. Or even shifting your gaze can sometimes help. Moving your eyes or changing your focus can disrupt the hallucinations, and always consult with a GP for coping strategies or therapy options. Professional advice can provide tailored strategies to help manage the condition effectively. Let's wrap it up. Bonnet syndrome is an eye-opening, pun-intended condition that challenges our understanding of how the brain works. It shows the brain's incredible ability to adapt and compensate for sensory loss. Imagine losing your sight and then seeing things that aren't there. Fascinating, right? This condition highlights the brain's complex mechanisms in dealing with sensory deprivation. So, the next time you hear about someone seeing things, remember, it could be their brain's incredible way of coping with vision loss. It's a testament to the brain's resilience and adaptability. Thanks for tuning into Mindful Insights. We hope you found this exploration of Bonnet syndrome as fascinating as we did. Don't forget to like, subscribe, and hit that bell icon for more intriguing facts. Your support helps us bring more insightful content to you. See you in that next video. Stay curious and keep exploring the wonders of the human mind.